Now, woven through all of this is some adult skills. So thinking about what resources do you as a parent need in order to be able to be the most effective parent you can be. So communication skills. So in whatever parenting partnerships you have, whether it's a spouse, whether it's a sibling, whether it's with a teacher, how you communicate about your parenting. And also for some of our groups, just also how do you communicate in general. How do you talk things over? Many of our parents have some of the same emotional regulation problems that our children have. And so thinking about how to help them in those interactions as well. Problem solving for parents, so that's another piece of that communication. So how do you solve a problem in a way that is positive? Because if parents can't do that, then they can't model that for their children. And we also do a unit on problem solving with children. Now, if their children are involved in the child group as well, there's a lot of focus in the child group about teaching children the problem solving skills. And so that's a really nice, there are very nice ways that the child group and the parent group mesh. We do a lot of emotion regulation skills for the children and a lot of problem solving too. So that meshes really nicely. But if the children aren't in that group, we try to provide the parents at least with the background so they can begin to do some of that coaching. Any questions?
Okay then.
Yeah.
I read your research over the summer. Not your, right? I
Yeah.
read the
Yeah.
research, and there were some pieces about communication with the school. And I work in a school, and I was wondering if you could speak a little bit more about the school piece.
Yeah. Absolutely. So in the basic parenting program, we're just working with parents alone. What we try to do is really support and empower and teach parents how to be advocates for their children and how to have a relationship with teachers that's not adversarial and that is with a positive problem-solving approach. And I think so often teachers and parents can really misunderstand each other. Teachers, when you talk to a group of teachers, they feel like the parents don't care. When you talk to a group of parents, they can feel like the school is out to get their child and the child. And really, in the end, everybody's got their child's best interest at heart, and everybody is feeling overworked and frazzled and helpless and like they don't know what to do. So one of the things we really try to do if we're working with a group of parents individually is get them to have some empathy for what the teachers are doing, and then also help them think about, how can I approach this teacher in a way that will be most beneficial for my child? How can I be proactive? How can I go in before I get that first phone call? Ideally, and in our programs we're working with the teachers as well, we also take that from the other side around. We try to help teachers see, if your first phone call to a parent is to complain about how this child hit somebody, you're not starting off on a very good foot. So when you have a child that you see as challenging, how can you build that relationship with the parents so you can problem solve it? So it's sort of both sides at once. When we are working with both parents and teachers, we actually set up and facilitate meetings where we don't take the lead, but we're there to support the parent and the teacher in how to communicate with each other. So very quickly, there are tons and tons and tons of research papers on this program, and I'm not going to go into all the details about all of them, but it is an evidence-based program. I'm one of the strengths of the program. This is one of the strengths. This is why I'm here to talk to you. There's good data to show that it works. All of our studies are randomized control designs. We in all of our studies try to do as many different kinds of reporting as we can. So we have parent and teacher report. We observe children in the schools. We observe children at home. Many of our studies we observe them with a peer in our clinic. So we really try to look at what's going on before the intervention and what's going on after the intervention in as many different ways that we can. I think at this point actually there's more than 7, but Carolyn has done at least 7 randomized controlled studies for children with conduct problems. So this is the treatment version. And there are at least 6 and probably more by now independent replications of other people, which again I think is another strength of the program. And Carolyn's a pretty amazing person. She's an amazing therapist and really, I think, does a very good job of working with these families. One of the tests of an empirically validated program is can someone else pick up the program and learn it and do it and get the same results. And so those 6 replications, I think, are a nice indication that yes, this can be done by someone besides Carolyn. Overall, what you find, little differences in terms of the studies, but overall what you find is that positive parenting increases. Negative harsh parenting decreases, use of physical punishment decreases. And in the studies where we measured and focused on it, you also see some improvements in parents' mental health. Now, these studies didn't take parents who were depressed, but we have, there are higher levels of depressive symptoms in these parents because they were stressed. So things like parental depression scores, parental stress scores do go down in response to being in the program compared to controls. And then also, of course, the ultimate outcome we want to see is, do children's conduct problems change? And yes, they do. And children's social competence increases as well. Prevention programs, slightly newer program. There are not quite as many studies, but similar and fairly robust findings across samples is that in prevention samples, and these are children who didn't come in, we didn't identify the children, but we identified the families or the schools, and similar changes in parents. Here for children who had problems in the clinical range, we see changes. Now, if you have a child within the normal range, you may not see that much change in the behavior of the clinical. You may see that. Okay. Let's see. A couple of minutes now. I think to show you a little bit of the program. I wanted to give you a flavor for what some of this looks like. So these are the actual vignettes that we would show parents. If I have time, I'll show you one or two in the first half of the program. So one or two from children who, from the play and praise, and then maybe if I can get to it, one or two for the reducing negative behaviors. So if you will, for just a second, pretend to be a group of parents. And I'm going to show you a vignette, and I'll lead a 2 or 3 minute discussion about what it would be like to be in a parent group. Okay? So just, you can pretend to be a parent and you can react just with whatever you really think, or you can pretend to be a parent and react with something you think a parent might say. So this first vignette that I'm going to show you is, I'm just going to, this is a slightly older child. She's about 10 or 11, I think, in this vignette, and she and her dad are doing a kitchen project together. As you watch this, look at the interaction and think about, in this program, we would be talking about child-directed play at this point. We would be talking about, or child-directed interactions, because it's a little bit older child, it's not just play. But what is this parent doing in this interaction, and what do you think? Do you think this parent is doing a good job of being child-directed? Do you think there are other things that he might do?
One of the most important aspects to making special time enjoyable is for the parent to avoid giving unnecessary commands or making corrections. In order for a child to feel valued and important in their relationship with you, their ideas and suggestions should be respected. Moreover, this respect, modeled on the part of parents, helps the child learn what it means to be respectful in a relationship. In the next vignette, think about whether the father could have avoided some commands or corrections, and how he could have promoted his daughter's ideas.
Actually, I'd hold back on the liquid for a little bit because we want to see how thick it is.
I'll put in the cookie cutter.
Well, here, let's do, I think you should do bananas next.
Then should I let it go?
Let's pour in the lime juice, and then let's kind of see how thick it is, how much there is.
Yeah, I think that one will probably be good.
2 scoops. It's not a lot of smoothie. And normally we come up to that after.
Well, that's what feel like special things and we drink like tons of. Okay.
Okay, I'm going to pause it for just a minute here. What do you think of that interaction? And maybe let's first of all start with, what do you like about that interaction? What do you think?
The
doing a project together.
Okay, you're doing a project together. It's a father-daughter combination. Also
In the kitchen.
In the kitchen. Yeah, yeah. And this is an age where some dads start to feel like it's hard to relate to their daughters. So this is, yeah, he's really made the time for that. Anything else that you thought was nice about it, you liked about it?
Well, it sounds like it's something that he likes to do frequently, that something that's important to him, so they're doing it together.
Okay, so he's sharing something that's important to him with his daughter. Yeah. Okay, I think those are really important things. Now, what do you notice about that interaction? What might you change if it were you and your daughter?
Yeah, he seemed to be pretty clear about letting it go first.
Yeah.
And it was kind of like his way versus
Yeah.
something a little bit more fluid.
Yeah. And do you think that's important in this particular project?
It probably doesn't matter so much about
Okay.
the outcome of this.
Yeah, yeah. But how many times do we do that as parents? I mean, there's a lot of things probably in our lives that we sort of feel like, whether it's with young children, how the dollhouse is supposed to look, or whatever this movie comes in. So yeah, so this is a really nice, it's almost a principle here of, as you're spending time with your children, can you let go of some of those adult-driven rules? And what would you suggest that he let her do? If it were you, how might you restructure this? You what?
Learn the cooking better.
Okay, yeah, so he did the scooping, right, let her
Well,
learn.
she wanted to do it earlier.
Yeah,
And then also the order.
absolutely, okay. So really let her take the lead.
It's all good.
Yeah, yeah, absolutely. And if you think about kids, what percentage of their day do you think is spent at times when it really is us directing them? It really is, we do need them to do something, and we need to do it now. How nice to sort of really think about it every time we do it, right? It doesn't matter. It's just a smoothie. It's going to taste just as good, and even if it doesn't taste just as good, right? Yeah. Any other thoughts? Yes?
I was going to say just some way to incorporate a little bit of praise.
Okay, absolutely. What might you praise her for here?
Just grabbing the bananas, knowing what step might come next, something
Yeah.
like that.
Okay, so praise her for her knowledge about smoothies, for her judgment on what goes in. Yeah, yeah. What might you sense, it kind of looks like she's enjoying this, but how might she come out of this interaction feeling? Do you think she's going to come out of this feeling that she's a good smoothie maker? Maybe not, yeah. So some of these things could empower her a little bit more, make her feel a little better about herself. So let's just freeze for a second here. We would lead a discussion somewhat like this, and you're seeing this out of context. There would have been a lot of videos coming after this, but the idea that rather than you as a group leader saying, don't do this, don't do this, a group of parents can think about this. As we go along, we make a list of principles that we put up on the board, and these are meant to be sort of general things, like this idea of, can you let go of the adult rules? Can you let your child take the lead? Can you incorporate positive attention and praise and fear? And those are, across all of your parenting interactions, can you really think about doing those things? And those become our principles, and we keep referring back to those in lots of different settings.
And,